primary bone healing. All right. Now, healing is going to start by the stimulation of the damage which has already been produced by the surgical procedure and interlocking of the implant, okay, to the hard and the soft tissue. Now, healing is divided into around 4 stages. Now, coming on to the first one, which is the stage 1, it is very similar to wound healing, so it is not much of a difficult concept to understand. I'll write it with the red pen. So, stage 1. Now, stage 1 is seen in 3 to 7 days after implantation. All right. Now, first thing that happens is the earliest angiogenesis. Angiogenesis, formation of the new blood vessels, and osteogenesis phase. Now, angiogenesis is seen at the broken ends, all right, of the vessels. Then, the sprouting or budding extension of pre-existing blood vessels. Then, pluripotent cells, they get activated. Now, they are more active in threaded grooves or angles of interface geometry. All right. Now, after the first week, after 7 days, there is going to be the formation, rapid formation of collagen fibers, rapid formation of fine collagen fibers and fibroblast. All right. Now, coming on to the stage 2. In stage 2, we will see it is occurring after 2 weeks of implantation. Okay, of implantation. Now, in this, what you will see is there is a ridge-like bone. Plus, it has some sinusoidal capillaries. There is a discontinuous bone segment. All right, at the base, and then it is going to adhere to the capillary network and form a continuous network. All right, then coming on to the stage 3. In stage 3, it will occur after 4 weeks. All right, stage 3, 4 weeks of implantation. Now, in this primary spongiosa, it converts into secondary spongiosa. And the bony trabeculae that are arising after the osteotomy procedure over the space, they will become parallel to the interface. All right, interface. Yeah. Then stage 4. In stage 4, it is going to occur after 6 to 8 weeks after implantation. Now, in this, what you will see is there is a formation of bone around the implant surface, formation of bone around implant surface. There is going to be a capillary plexus between original bone bordering the osteotomy and new bone bordering the implant. This is a very beautiful point. Must remember to write it. Alright, then bone within the grooves, threading, begin to fill in. Alright, then thick plates of trabeculae appear. Now, there is one more way in which you can portray this, and it is very easier to understand. Phase, alright, then we have timing, then we have specific outcome. Okay, this is also easy and it is a table format, so easier for you to gain marks. Inflammatory phase. Alright. Then we have proliferative, and third may we have maturation. Alright. IPM. Maturation. Yeah. So in this 1 to 10, this 3 to 42 days or 40 days, and this is more than the 78 days, alright, or more than 28 days. So let's talk about it. In this, what occurs is adsorption of plasma proteins, platelet aggregation, and activation. Blood clot will be formed, है ना, वही same. फिर neovascularization, वही angiogenesis, alright, and differentiation of cells, वही same. Pluripotent cells वाला point. Then maturation में basically remodeling, implant loading, physiological bone resorption. Now, it is very repetitive, I know, but I have given you around 2 ways to write the thing. Then you can also talk about biological phases. In biological phases, पहले osteophytic phase आती है, then conducive, then last में osteoadaptive. Okay, this is very important. Same points you have to mention, but on biological level they have different names. Blood clot formation, inflammation, inflammatory exudate, PMNLs, and converting into the what was it? PMNLs converting into phagocytic cells. Yeah. Then neovascularization, angiogenesis, ossification. Okay. In this, woven bone plate will be formed. Then lamellar bone formation will start. In this, balance remodeling. Last phase is so adaptive already means it is going to remodel. All right. Now, one more way to talk about healing is according to Mish. Mish is a very important name in the implant dentistry, all right? So we must mention him in an answer of implants. So for he tells that there are two stages only for the healing. पहली is surface remodeling and then is remodeling and maturation. इसमें आगे there are 4 phases, all right? You have to mention the same points, just the names are different, all right? Now, in surface remodeling, he says there are 2 phases, S1 and S2. In S1, he says that this is the woven bone callus formation phase. Okay, which is 6 weeks. Important. Now, in this second phase, he says that there is lamellar compaction. Now, very important. 6 to 18 weeks. Now, remodeling and maturation may also, he says 2 phases again, S3, S4. In S3, we have interface remodeling. Now, whenever lateral compaction is starting, tabhi se hi interface remodeling starts. Alright, so 6 weeks only. Then compact maturation, very important. Compact bone maturation. 18 to 54 weeks. You have to mention the same points. I'm just giving you an outline form how to write it. So yeah, I hope you understood the video. It was definitely a very easier topic to understand. I hope I made it easier for you. If yes, do subscribe to my channel. Thanks for watching.